Hi everybody, my name is Julie Valderrama and I'm a nutrition student going into my 4th year at Brescia. And today what I'm going to be teaching you guys, or kind of explaining to you guys together, is how to use the new website for the healthcare to access your healthcare through Western. So what I'm talking about specifically is health insurance. And if you've seen my video before where I talk about health in Canada, this one is to specify on the health insurance that's provided through Western. So if you're an international student, you have UHIP, which is a requirement from the Ontario government for all international students. And then you have the choice of the one through Western, which is what I'm going to show you today. So what we're going to do is we're going to learn how to use the website together as a team. So let's start by sharing my screen. And what you're going to Google is UWO, which stands for University of Western Ontario Health Student Benefits. And you will Google it. And it is the first link that pops up where it says health plan. And recently, actually, during this loading time, Western changed their new, their healthcare plan. So we're going to be looking at the new website. So we're going to go all the way to where you see Purplecare. Purplecare is the name of their new health benefits plan. So this website was posted quite recently, and we're going to go through it. So it kind of looks like this. And it shows you that you have online video counseling that's free the first time. And it gives you a lot of easily accessible information as well as a language selection, which is always nice. And you can also always search if you have a quick question that you know is easy to find. So first we're going to go through our benefits plan details. So my benefits at a glance. Essentially, this explains to you very quickly what you are covered for, such as prescriptions, if you ever need an ambulance, vision or healthcare practitioners, which we'll go into more detail as to what is included in that. You can also get medical equipment and supplies that's covered, dental coverage, or a dental accident. So let's say you accidentally fall and break a tooth. And also for traveling and tutorials if you are sick and you need to pay for tutoring. So now we're going to go all the way back to the top, and I'm going to show you the different links that are available here. So right here is My Wellness, which is a new system that they're doing to assess your mental health, as well as it can easily connect you to a crisis text support line. As you've hopefully noticed, there are a whole lot of different resources available at Western, especially for mental wellness. Western takes mental health care very seriously and provides a lot of different services that fit your needs. So let's look at prescription drugs. So right here gives you more detail of what drugs are covered and what that means. Supplemental health explains to you what practitioners are available. So I want to look at practitioners, so I click that tab, and it shows you what different people you could see and what you could be covered. So for example, dietitian, you could be covered $40 per visit. And for x-ray, you can be covered $25. As well, for a licensed psychologist, psychotherapist, or social worker, you can be covered $750 and more. And if you ever have any questions, keep in mind there is a number that you can always call, which is right here, or an email that you can email if you have specific questions that you don't think the website is answering. So far, when I went through the website, it was able to answer all of my questions. So we'll look at other insurances, and this is a little bit of a more serious insurance that you can look through and read during your own time. So my biggest suggestion for you as a new student is to try and get really familiar with this website and know where to find information. For example, I travel to Florida to see my family, and I have the tendency of getting sick very easily, so I always look at my travel insurance, and I'm very familiar with this. And then exclusions explains what is not covered or what is limited. For example, what is not covered, first aid supplies, anti-smoking remedies, and many more things. You can go through it on your own time. So now we're going to go to plan enrollment. So plan enrollment shows you how to opt out. So if you want to opt out of this, which you have to do before September 23rd, you have to click here, and it answers your questions, and it gives you a kind of information that you have to fill in to opt out, which I'm not going to show you how to do because I'm not opting out. You also have terms and conditions for when you opt out. And you can also see here eligibility criteria. So what you are eligible for and your coverage period. So this is also very important. September 1st to August 31st is when you are covered, essentially when school starts. Also, if you have family members here, you could also get coverage. For example, spousal coverage and dependent children. Of course, there are some restrictions, so your child has to be under the age of 21 and not a full-time employee, and many more things. You could also, if you have two benefits, for example, the health benefit of UHIP and then your student benefit, you can coordinate so that you get 100% coverage, because not all benefits cover 100%. Every benefit plan has a lot of different tricks for it. So for this one, you can read through everything on your own time, because I'm sure that you'll want to read this on your own. But this explains to you how you can use your benefit plan. Something to keep in mind is that your primary plan is the one that you've had the longest, and it's the one that is first covered. So for example, for me, my longest one is my health plan. So that is, my health plan with Western. So that is the one that is my primary, and everything goes through that. And then what's left over will be covered. For example, if you go to get a prescription, often the pharmacist explains to you how it's going to work. So now we're going to look at claims. So let's say you went to see a massage therapist and you want to get covered for it because it costs money. First of all, you need your benefits card, which is quite easy to do. You put your full name, your student number. You can either print it or you can get the card emailed to you. So I already did this, so I'm going to show you what that looks like. And I think it shows it here, which is sorry, I just have to see. Oh, it paused it. 1 second. Sorry, I'm still learning how to use technology. So this is my benefit card, and it has my name, my student number, and the plan number. And this is what I'll show if I ever go to, let's say, to the doctor, or if I ever need to go to massage therapist, or when I get prescriptions, this is what I'll give them, and they'll type in that number in for you. And some places will do it for you. Some places ask you to do it. So we're going to look at how to do it yourself, because oftentimes you have to do it yourself. And that is through GroupNet. And GroupNet gives you right here a nice video that explains to you how to actually log into your services and how to put in your receipt for your appointment. So you can watch this on your own time, but here's some more information that might be more important for you. And here's some more information about your policy number. So a lot of these words can be confusing, and if you ever are confused, you can always call for help, which is at the bottom again. You can ask this email and they will answer you promptly your questions. And you can also make your plans so that when you get paid back the money that they're covering, you will get that into your bank account as a direct form and not as a check. So here is the health claim form, which I will show you. And the health claim form, essentially, it looks like this, and you fill in the information. So I would fill in my student ID, my first name, my last name, where I live, and then right now I would write what my coordination benefits is, if that was my case, and henceforth you fill in all this information. So now we're going to go back to the to the website. And there's also a dental claim form for dental, which is pretty similar, and you can go over that on your own. And then you can also see your history of all the claims that you've done to keep track. So this might be of interest for international students who haven't come to Canada yet. And this is only for students, not for the family members. And you can go through this on your own time, because I think that would be best than me telling you everything. So now we're going to look at the practitioners that you can get. So this specifies exactly how much each practitioner is covered. For example, a chiropractor allows you to have $30 covered for the assessment, and then if you require treatment for what they assessed, it would be covered up to $25. And then for vision, sorry, it's a little bit different. And it's not loading. But anyways, you can go over these tabs yourself and read over this. Let me see if it works again. Oh, there you go. So this is telling you that eye care is provided to students, the staff, and the public. And you can find this in the lower level of the UCC building across the bookstore. And they can do a lot of different things for you. Last thing we're going to go over is the student resources, which is a web page that takes you to a bunch of links of resources. So this is the building where you go to get non-urgent medical care. Of course, if you have an urgent medical care, you should go right ahead to the hospital or call 911. But for a non-urgent care, this is where you would go. And these are a bunch of links that could be quite helpful for you, as well as club links if you are looking for that. And then the peer support, which offers a lot of different things, such as food support, charity, international student support, and so on and forth. So as you can see, the new system, Purplecare, has a lot of information that you can go through on your own. And so now that we've gone through the website, I just wanted to mention, because my program canceled on me, but essentially, if you have any questions, please contact Lisette on her phone number or email, and you can ask her any questions regarding specifically for Brescia students.